Our heart has four chambers, two upper and two lower. Two major blood vessels arise from the lower chambers. There are four heart valves which regulate blood flow from the upper chambers to the lower chambers and from the lower chambers to the major blood vessels. Function of the valves is to prevent backflow of blood so that forward circulation of blood can be maintained. These heart valves can occasionally be abnormal at birth or become abnormal later due to disease processes. This is known as heart valve disease. Symptoms and signs will depend on which valve or valves are actually abnormal. It will also depend on the type of abnormality in the valve, whether it is narrowed or leaky or both. Sometimes more than one valve can be abnormal in the same person. Then the symptoms and signs will be a combination of those for the involved valves. Disease of one valve may also modify the function of other valves later on. The upper chambers of the heart are right atrium and left atrium. Blood returning from the body after oxygen extraction reaches the right atrium. From the right atrium, the blood flows to the right ventricle, the lower right-sided chamber. The opening between the right atrium and right ventricle is guarded by the tricuspid valve. Right ventricle pumps blood to the lungs for oxygenation through the pulmonary artery. Pulmonary means in relation to the lungs. The opening from the right ventricle to the pulmonary artery is guarded by the pulmonary valve. Blood returns from the lungs after oxygenation to the left atrium through the pulmonary veins. From the left atrium, it passes to the left ventricle, the lower chamber, through the mitral valve. Left ventricle pumps blood to the aorta through the aortic valve. Aorta takes the oxygenated blood to the whole body. One important disease seen especially in the developing countries, known as rheumatic fever, is a major cause of heart valve disease. Rheumatic fever affects major joints of the body as well as the heart valves. Though the joint symptoms recover quickly, the damage to the heart valve may progress lifelong. It is often said that rheumatic fever licks the joints and bites the heart. Left-sided heart valves are more commonly involved in rheumatic fever, of which mitral valve is involved most often. Please view the full version of this video at my Cardiology Talks channel and subscribe for updates. Useful for early career medicos and paramedics. Link given below this video.